any change to a diet from like the standard American diet or from processed food is a good change. Getting rid of processed sugar, processed carbs, and processed oils, which is mostly in processed foods, and just sticking to meat, fruits, and vegetables. I mean, if you can do that in life, like you're going to be way better off than, 80, 90% of the people out there.
This is the Recovery After Stroke podcast with Bill Gassiamis, helping you navigate recovery after stroke.
Hello and welcome to episode 221 of the Recovery After Stroke podcast. To learn more about my guests, including links to their social media and other pages, and to download a full transcript of that entire interview, please go to recoveryafterstroke.com/episodes. If you would like to support this podcast, the best way to do it is leave a 5-star review and a few words about what the show means to you on iTunes and Spotify. If you're watching on YouTube, comment below the video, like this episode, and hit the subscribe button. And to get notifications of future episodes, hit the notifications bell. Sharing the show with family and friends on social media will make it possible for people who may need this type of content to find it easier, and that may make a massive difference to someone that is on the road to recovery after their own experience with stroke. My guest today is Dr. Nicholas Schmidlkofer, who is a licensed chiropractor and a functional neurology practitioner who supports people to overcome neurological conditions caused by concussions, as well as dysautonomia, ADHD, dizziness, Parkinson's disease, and headaches, just to mention a few. This was a detailed episode and requires multiple listens to grasp some of the concepts, and it will also help if you have an open mind, as some of the topics we discussed are a little bit counterintuitive. Dr. Nick Schmidlkofer, welcome to the podcast.
Thanks, Bill. I'm happy to be here.
Happy to have you here, man. Thank you so much for agreeing to be on the show. One of the reasons why I asked you to be on the show is because you're a doctor, you're youngish, you're probably speaking the language that people need to hear from doctors in, and that is a rare thing, especially when it's very difficult to have conversations with doctors about things that are serious and that are explained in a way which are easy for patients, especially stroke recovery patients, to understand, right? In that acute phase when they're doing we're doing it really hard, right? So before we get into the podcast proper, tell me a little bit about you and what you do for a living.
Yeah, so I'm a doctor of chiropractic by trade. So my degree was in chiropractic. And then after that, I got a diplomate by the American Chiropractic Neurology Board. So basically, it's a 300-hour program where we do 300 hours worth of coursework, and then we do a big test and practical afterwards. And that just basically gives me more knowledge on the brain, the nervous system, a little bit of nutrition, metabolic, and everything that has to do with our brain and body. And so the last 4 years I've been practicing in Chicago at the Neurologic Wellness Institute. And what we do is we treat predominantly brain injury cases. So mostly that's concussion or like severe traumatic brain injury, mild traumatic brain injury. Either one of those, but we do also get a lot of stroke patients, or I should say post-stroke patients. And then we get a lot of variety of other things. So those others would be anything from dysautonomia or POTS, which is postural orthostatic tachycardia syndrome. We see patients with neurodegeneration, Alzheimer's, Parkinson's. We see patients with dizziness or vertigo. And then, of course, all those patients I talked about before, like concussions or post-stroke patients, can have dizziness, can have vertigo, can have dysautonomia. They can have all those things. They can have headaches, they can have migraines. So that's one thing that's cool with the brain, is there are different areas in the brain and they can all cause similar symptomatology. So you kind of have to piece out where is the issue. So yeah, that's mostly what I treat, or what we treat here. We have 3 clinics. And obviously, I don't want to really advertise or anything on this. I really just want to be be really clear, like we have 3 clinics and we have a lot of people doing great things in our field, not only in our clinics, but around the US, in Australia, in Europe. We have a lot of people that want to do things with functionality. So, and functionality is really just looking at the brain in a way that is based on function. So we have multiple areas in the brain. They all talk to each other in different ways. And so we can look at an individual, we can look at their eye movements, we can look at their facial tone, we can look at their posture, we can look at how they move an arm or leg, and kind of pinpoint areas in the brain that might not be working as well. And then we can work on them by using the areas that are working better. And normally that requires less inflammation, that requires a good metabolic compromise, that requires good nutrition, like all those things as a foundation to then get those things moving forward faster. And that's kind of what that functional neurology is. Most of the time when people have a stroke, they're going to get an MRI. They might see little lesions on the MRI that are termed structural, as in we can see them. But that might not be the only area that is of concern. There might be other functional areas that are involved. On the other hand, concussions, you don't see anything on an MRI. So there's no structural issue. It's all functional. And so that's how we kind of look at the brain by function, and we treat it by function.
Yeah. I love what you said. Well, firstly, I like the idea that you're a chiropractor that understands the way the body's put together, all the little bits and pieces, how they connect to each other, how one thing, say in the neck, affects the leg, or the thing in the leg affects the neck. And I like that that chiropractors understand the toe, the injured toe, how that affects the gait, how that affects the muscles on the other side of the body, and how that can cause problems in the spine, and that can cause a headache, for example, or something else. I love that there's this knowledge of understanding from, well, the problems in the neck, but I wonder if it starts somewhere else, and dealing with the source of the issue rather than where the symptoms appearing. And then that takes me into, functional medicine, which is a similar approach. Functional medicine doctors, practitioners will talk about the cause. What's the underlying cause of your symptom? And let's not treat the symptom. Let's solve the problem at the cause. And then you're talking about functional neurology. And that's, again, like these great terms and ideas of actually going into the neurological space in the person and then working out from there backwards and dealing with the source of the issue rather than for example, this might be a bad example, but the memory loss or the fatigue or whatever. Okay, you're dealing with the fatigue. Well, rest more or sleep more or whatever, but there's clearly an underlying issue, and that was what I noticed for me. So my brief history, so we can make it part of our conversation together, was that in 2012 I had a brain hemorrhage caused by an arteriovenous malformation, a faulty blood vessel that bled, and then 6 weeks later I had another bleed from the same blood vessel that was more dramatic, far more blood and a lot more deficits that I experienced. I experienced a lot more losses of my function. And then fast forward about 2.5 years later, I had another bleed from the same blood vessel, which eventually had to be removed through surgery. And in that time, in that 2.5 years between the first bleed and surgery, I experienced fatigue. I experienced memory loss. I didn't know my name at one point, couldn't recognize my wife, couldn't keep time, couldn't make my appointments, couldn't drive, couldn't work. And I had the presence of mind of knowing that whatever was happening to me, that I could potentially be contributing to it and making it worse. And I'm not sure where that thought came from, but that one thought made me look into what can I do to support the healing of my brain and the areas that aren't affected by the blood directly, but are affected nonetheless. And the only thing that I could come up with, which started this entire thing later on, which became the podcast, and the only thing that I could come up with was they were giving me a drug called dexamethasone to deal with the inflammation at the source of the bleed, at the site of the bleed. And I wanted to get off dexamethasone because it was a terrible steroid drug to be on. The symptoms were just unbelievable what it was causing to me, including insomnia and the feeling of bugs crawling up my arms and hallucinations, weight gain, you name it. And I thought, is there any way that I could support my brain to become less inflamed? And if there is, what is it, and can I do it on my own? And immediately the Google searches that I did came up with nutrition. And it was so easy because I could do that from home, and I was spending a lot of time at home, and all I needed to do was, instead of do something, I had to stop doing something, which all that meant was I needed to stop, for example, drinking alcohol, drinking sodas with high amounts of sugar in them, stopping the consumption of gluten, decreasing the consumption of caffeine, and decreasing the consumption of dairy. And I noticed that even though I had all this stuff going on in my head, I was still able to have a lot of control over how I felt, because when I chose to eat bread, once a month or once a week or whenever I felt like it, I noticed how I felt soon after. Yeah. And soon after was debilitating fatigue, bloatedness, inability to be myself again. And I started noticing that I was doing that to myself more and more every time I ate. And then that went away, Nick. That just went away. And I was dealing with the only thing I was dealing with was what the blood in my head was doing to me. I wasn't dealing with what I was also doing to me.
Yes.
So that's why when I saw your Instagram, I thought, well, I've got to get in touch with this guy, because you're talking the language that I don't know how to speak to the people listening to this podcast who will really benefit from it. So I want to touch on less inflammation. That's one of the first things you said. Tell me about inflammation, what it is, what it does, and why it occurs when somebody has a brain injury in the acute phase, and then why it kind of hangs around.
Of course. So the first thing with the acute inflammation is, so an ischemic stroke, hemorrhagic stroke, either one is going to cause inflammation. It's basically a traumatic brain injury without the hit to the head, right? And so let's just talk about an ischemic stroke. That's just basically we, squeeze off a blood vessel. There's no oxygen getting to the tissue that's supplying that the blood vessel is supposed to be supplying. And so therefore the brain is not getting oxygen. If the brain's not getting oxygen, right, we need oxygen to live. Like, how many people can hold their breath for more than 5 minutes? I mean, I can't hold my breath for more than a minute. So, but we need oxygen. Yes, exactly. Those ridiculous people are crazy, right?
People.
You're right. But if the brain's not getting oxygen, the brain uses oxygen to make ATP. I know you had Dr. Clark on, listened to him, and he's a great guy, and we've learned actually a lot from him. But with ATP is an energy currency in the cell. So basically, just how we use money to buy things, well, the cell makes ATP from our energy sources to then use it to produce functions in the cell. And one of those main functions that are super important for brain cells or neurons are going to be to keep the electrical potential balanced. That means we have like electrolytes, right? Sodium, potassium, magnesium, calcium. Those need to be in their separate areas, which means potassium needs to be inside the cell, sodium needs to be out. And if we don't have enough oxygen to make ATP, we have a specific pump that's constantly it's working against the gradient to get sodium out, potassium in the cell. And if we don't have that, now all of a sudden that threshold for the neuron goes down. Now, rather than you might need a really big push to get the neuron to fire, now it's just like a little tap, and all of a sudden it's like boom. It's kind of like when you go, when somebody has a dog, when all you have to do is kind of tap on the door and they start barking at you, right? Kind of like that, right? I mean, versus somebody doesn't have a dog, you have to kind of bang, bang, bang to get their attention to, right? So now that lower threshold, that little tap means that your brain's sending signals when it shouldn't be. And when the brain's sending signals when it shouldn't be, then it kind of gets out of control and it leads to the brain, those neurons start to die. They start to undergo these different cellular processes that cause them to die. And when they die, they release products that cause more inflammation, basically. And so you have other cells in the area that are trying to reduce the damage. You have these inflammatory cells called microglia that are trying to reduce the damage, but they cause more inflammation. You have the blood flow from the other areas or that are getting blood flow. More immune cells are going there, causing more inflammation. And so that's like the acute process. That acute process is generally good. We need to kind of control that and have that happen, but to kind of control the overall damage. The problem is when it kind of lasts and it keeps going, is then you can get this secondary injury where it's like secondary inflammation causing more problems. And then on top of it, so you kind of have, your brain is a skull, right? And so when inflammation gets there, just like when you have swelling in your hand after you injure your wrist or something, you get swelling in your brain. So that causes pressure and pressure buildup. Well, you have arteries that go to your brain, you have veins that come away, and those veins need to release or kind of get rid of those toxins. And so when just like any cell is dying, there's waste that is being produced, there's toxins, there's the inflammatory molecules that went up there, cytokines to help with the inflammation, those signaling molecules, they need to also be drained. And if they're not being drained properly because there's damage to the veins, there's damage to the lymphatic system. So the lymphatic system also deals with drainage. Then that inflammation just kind of sticks around. Okay. Then on top of it, you add in the autonomic nervous system. So the autonomic nervous system is like our sympathetic, which is our fight or flight nervous system, kind of like you got to run away from a bear, versus the rest and digest or parasympathetic system. And when you have a brain injury or any injury, your fight or flight system has to be up and elevated because it has to try to take care and keep you alive. The problem is the brain controls that. And so there are lots of areas in your brain that control that. Mostly it's going to be like the midline structures in the brainstem. Brainstem, and then a little bit higher up in like the basal ganglia, it's called. Those midline structures, there are a lot of connections that are crossing through that midline. So just about any head injury, any stroke is going to affect the autonomic nervous system. And the autonomic nervous system, besides controlling that fight or flight, rest and digest, the rest and digest part, that parasympathetic, is going to have an effect on the gut. And so you have a nerve called the vagus nerve that has to run down, goes to all of it's my favorite nerve, by the way.
The wandering nerve.
The wanderer. The wandering nerve, right?
Yeah.
In Latin, vagus means wandering, and goes to the heart and the lungs, and it goes to most of your digestive organs, most of your gut and colon. And the greatest thing about it is most of it's actually sensory. So most of it is picking up, 80% of it is picking up what's actually coming from the gut. And so if before the stroke, before the head injury, you had inflammation, you had dysbiosis, your microbiome was off, you weren't eating healthy, well, your vagus nerve was telling your brain that, your brain was figuring it out and sending signals back down that it has like this anti-inflammatory reflex to kind of like calm it. Well, now with the brain injury, you can't do that. And so these signals are coming up, your brain and gut are disconnected. And that is going to perpetuate the inflammation. Now, all of a sudden, a leaky brain leads to a leaky gut because damage to the brain causes this blood-brain barrier that helps to protect it, causes it to be leaky. Now you have a leaky gut as well. Microbes are getting in, toxins from your food and pesticides from your food are getting in. It's not necessarily a great scenario. And so once that acute inflammation settles, then you're left with, okay, do you have a good working autonomic nervous system? And if you do, great, you might have a couple other issues. If you don't, well, then you're going to have this chronic inflammation going. And especially if you're not supporting it with the proper diet, proper nutrition, or even lifestyle factors like just stress and sleep. I talked about that lymphatic system and draining toxins. Sleep is the most important thing for draining toxins. You have to get to your slow wave sleep in order to drain those toxins at night. And if you're not getting into that, which is also a brainstem mediated midline structure thing, then you're not actually going to get rid of that inflammation.
Right. Wow. That's a lot to unpack. Let's unpack it. All right.
Yep.
So let's talk about the autonomic nervous system. So for people listening and watching who are hearing it for the first time, this is the way I understand the autonomic nervous system. It's the part of the nervous system that makes things work, which we don't have to think about, like our heartbeat, like our need to go to the toilet, like where our eyes go, all those things, like the way our tongue moves, all those things that are related to automatically happening, that things that happen that we don't have to think about. It's a really good system to have in place.
Yep.
And the autonomic nervous system can be messed up. It can be interfered with by all the things that Dr. Nick spoke about, all of the stuff regarding the inflammation, because what it can do is it interfere with the signals coming from the brain and the gut as to how it should be operating. And when it's receiving signals that are not optimal or only half signals because there's interruptions in that process or because things aren't operating properly because of inflammation, then it kind of goes a little bit off whack. It's kind of like an out of tune car that is kind of running and kind of gets you to where you want to go, but you can tell it just doesn't feel right and it needs to be retuned and reserviced or the oil change or something like that. So the autonomic nervous system, it appears to be out of our control, but we can actually take control of it as well. And one of those ways is breathing and meditation, which you touched on, right? So yep. Breathing, basically, when you decide to do a 4-minute breath in, a 4-second breath in and a 4-second breath out, and you're counting to, say, a metronome or a timer or something like that, you're actually taking control of your autonomic nervous system. And what you're doing is you're bringing the sympathetic arm and the parasympathetic arm closer to the middle line, and you're making it more balanced, and you're able to then influence factors like your cortisol levels, your stress hormones, all of that in a positive way. And that helps to decrease the stress and the inflammation in your body. So that's why meditation and breathing properly is important. So
that is the first exercise I give every patient is breathing.
Yeah. So tell me about your spin on breathing and what you feel breathing can help accomplish, other than, and this is again something I want to emphasize because control in stroke seems to be in people, it seems to be lost to the doctors, but here is another way you can take back a little bit of control in what you're experiencing simply by choosing a balanced breathing exercise. Nick, tell me about your thoughts on breathing and how important it is.
Yeah, so research shows that 6 breaths a minute is the best to activate the vagus nerve. And so that's 10 seconds per breath. So my suggestion for people is like 4 to 5 seconds in, 5 to 6 seconds out, always through the nose. And again, only into the belly and maybe a little bit into the chest, right? We're trying to activate the diaphragm. If the diaphragm is properly activated, we breathe into our belly. Our kidneys actually move like a mile a day because they're just going back and forth if we breathe properly. And so that activation, like I said, the vagus nerve is 80% sensory. So the activation of breathing properly into your belly and moving your organs is activating your vagus nerve, sending those rest and digest signals, those calming signals. And it can really just kind of settle that autonomic nervous system. like you were discussing. And therefore I can control your heart rate, decrease stress levels a little bit. Obviously we can't take away stress. We can't take away stressors in the environment, but again, what you just said, having a little bit of control over, you can't control too many things in life. You can control your attitude and your effort. And it's kind of like, so if other things are around in the environment, I mean, heck, just come back to your breath, have a positive attitude, and just, have a good, effortful, nice and easy breath in and out through your nose.
Now, let's talk about the nose. The nose. Why is it important in and out of the nose?
Many reasons. The nose humidifies the air. So it has all these little turbinates and stuff in it that humidifies the air. So therefore it's going to be better in the lungs. When you breathe through your mouth, you don't actually, your tongue isn't set properly. And so therefore, when your tongue's not set properly, you're going to have more dehydration, especially breathing out through your mouth. And it can also lead more to like sleep apnea stuff. So basically your palate might fall because you're not breathing properly. When you breathe through your nose, just everything is working better. A little aside to this, like I mouth tape every night to make sure that at night I'm breathing through my nose. And it's amazing how after a month of doing it consistently, like my sleep has never been better. So it's one of those things where breathing through your nose is definitely essential. And a lot of people don't do it. You look at a lot of kids that have maybe like ADHD or other issues like that. A lot of times they don't know how to breathe through their nose. The other thing with the nose too is breathing through your nose, your olfactory nerves are directly attached to your limbic system. Your limbic system is more of like emotions and memory. And so by breathing through your nose, you're actually getting more oxygenation, more blood flow into those memory centers, into your emotional centers, which can not only calm your emotions, but settle down like anger and aggression and sadness. So,
and this particular suggestion, which I hear a lot of, and especially on episode 19. So anyone who's listening, way back in episode 19, almost 200 episodes ago, I interviewed Patrick McEwen, who was a Buteyko method trainer, coach, expert. And the Buteyko method is a breathing method, and he talks exactly about those things that you just spoke about. And also, I'm going to say this very crudely, but it creates the correct chemical balance when you breathe through your nose, the correct chemical balance in the oxygenation of your blood, and then in the expelling of carbon dioxide, I think. Yeah, out of your nose. So when you breathe out of your nose. So it's really, really important to have a good airway, a clear nose passages, so that when you're breathing, you're doing all those things, because it is such a simple gain, such a simple win again, and you get such massive results by doing it, right?
Yeah. Yep.
So breathing through your nose is really important. Something that people could look into is perhaps with their doctors, if they feel like they can't breathe well through their nose, go get it checked out, see if there's a deviated septum or something, and start to attend to those types of things. Mouth taping, it might be something that's quite new for people to hear. Explain to me a little bit about what specifically you do with mouth taping. What do you tape it with?
Yep. Yeah, for sure.
What does it feel like when you rip it off in the morning?
Well, first of all, you're right about the deviated septum. Like definitely, if you go get it checked out. A lot of people have deviated septums because they hit their head as children, and it just like grew differently. Also checking for like chronic infections that might be clogging that. But mouth taping. So mouth taping, I just take like a little bit of the brand is NextCare paper. It's like paper tape. So like if you ever go to the hospital and you have an IV in you and they put like a little bit of that like paper tape over just to hold the IV needle there, that's kind of what it is. It's not a strong tape. It's very gentle. Get the most gentlest type. And I don't put it like across like that. I put it just straight down. And so by putting it straight down, it just keeps the lips sealed and allows you to breathe through your nose. The first week or so, I woke up with it every middle of the night with it on my hand, right? my body just said, I'm not breathing well to my nose, I'm going to rip it off. But as you go forward, as I went forward, and I've heard this about multiple people, you actually create more mucus if you're breathing properly through your nose initially, because if you weren't breathing through your nose, now all of a sudden you're getting all these like air molecules into your nose, and your nose is like, whoa, we're not used to this. We need to defend it with some mucus. And so you might have to blow your nose more for the first week or two, but after that, man, it's like you're clear as day. And then now I don't take it off at all at night. If I am sick ever, I don't wear it because, it's just my nose is too clogged. But yeah, like it's amazing to be able to wake up and after 8 full hours of sleep, not wake up once throughout the night and just feel like refreshed. And that's kind of what I feel every morning. So
let's talk about the balanced breathing or the breathing that you mentioned, which was 4 or 5 seconds in, 5 or 6 seconds out. Why the longer out breath?
So the longer out breath has been shown to activate the parasympathetic nervous system. A lot of people like to do like 4, 5, 6 or 4, 5, 8, where they go in for 4, hold for 5, and then out for 8. I think that can mess up oxygenation levels a little bit, where you're actually breathing off more carbon dioxide than you're actually producing in your body. Some people do need that. But I just want to get a little bit of the parasympathetic nervous system, that rest digest activation, without doing too much. So that's why I just go a little bit longer on the out. We don't want people to get over-oxygenated. Over-oxygenated can actually cause a little bit of anxiety in some people. So
if you've had a stroke and you're in recovery, you'll know what a scary and confusing time it can be. You're likely to have a lot of questions going through your mind. Like, how long will it take to recover? Will I actually recover? What things should I avoid in case I make matters worse? Doctors will explain things, but obviously you've never had a stroke before. You probably don't know what questions to ask. If this is you, you may be missing out on doing things that could help speed up your recovery. If you're finding yourself in that situation, stop worrying and head to recoveryafterstroke.com, where you can download a guide that will help you. It's called 7 Questions to Ask Your Doctor About Your Stroke. These 7 questions are the ones Bill wished he'd asked when he was recovering from a stroke. They'll not only help you better understand your condition, they'll help you take a more active role in your recovery. Head to the website now, recoveryafterstroke.com, and download the guide. It's free.
Yeah. So if we're getting people by breathing out just that 1 extra second out as opposed to in, you actually bring people down into the rest digest phase, which is the less activated phase. It's less cortisol running through the system, less heart rate, less blood pressure. Everything, all the markers that stroke survivors need to monitor that we don't want elevated actually tend to decrease. And that just 1 extra second out just does that. It actually allows people to just dip under the line of being a balanced autonomic nervous system to slightly into the rest and digest phase more so. So people should notice by practicing that once, twice, or even 3 times a day. I prefer to do it in the morning when I wake up, middle of the day, say if I'm driving somewhere, and then just before I go to bed at night. And what it does is it actually puts me into those calmer states. So I'll wake up calmer, I go to bed calmer, I sleep better as a result. And then when I'm in the middle of the day and the traffic's getting to me, or the wrong music's on the radio, I'll just breathe and I'll calm down, and it will really help to just deactivate those fight or flight responses, those responses where, sometimes they run haywire and you're not realizing that you're losing your shit and you're acting like an idiot, which I've done before, right?
Yeah, but you're right. Like I recommend when you're driving is huge. Like you have the seatbelt right by your belly button, and you can just breathe into the seatbelt, and it just like creates a little bit of kind of feedback, right? Proprioceptive feedback to breathe into your belly, and you just breathe in and out through your nose. It's the best time to work on breathing because it is generally a stressful environment.
Yeah. And if you're thinking that you don't know what the hell we're talking about, what type of breathing that is, just jump onto YouTube and just Google and and search diaphragmatic breathing, breathing through the diaphragm. And you'll see there'll be tons of videos of people showing you exactly how to do that. And it's the way we used to breathe, but for some reason, and it's the way babies will breathe. When you just put them down in the cot, you'll see that they'll immediately just breathe in their belly and their belly will move in and out. But for some reason, adults seem to breathe through their chest and try to expand their lungs and get more oxygen into the lungs rather than drop their diaphragm and elongate the lungs.
Exactly.
I'm not sure why that is.
There's a few theories. One theory is obviously like vanity. We want to suck in our gut to look good as we get older. So you think of like, even 5-year-olds like looking through magazines and seeing people and their models that are just not realistic and they're sucking in. The other theory is when you start going to school, whether you're like 3, 4 in preschool or 5 kindergarten, and you're sitting so much, sitting is just going to contract your hip flexors more. And then the hip flexors actually have a connection to that diaphragm. And so that can actually turn off the diaphragmatic function. And then so people start breathing into their lungs more or their chest rather than belly. So there's a few theories. I don't know if we know which one's best or which one which, but yeah.
Awesome. Tell me a little bit about the blood-brain barrier, because all these things are connected. The blood-brain barrier is something that was severed for me when we needed to have brain surgery, right?
Yep.
And as a result of that, I was quite aware of the impact of that and what that might actually do and cause. However, there wasn't much I could do to heal it. It had to heal by itself over time, but with me doing all the right things, eating appropriately, minimizing sugars and minimizing all of those additives in my food. So it became very clean eating at home, cooking most of my meals, etc. But what happened to me was I had a thyroid condition where one of my thyroid glands was way too large. It was becoming a problem in my airway. And as a result of that, about 18 months after my brain surgery, I had to have part of my thyroid removed. And when I woke up from surgery, my left side deficits were far worse than they were when I went into surgery. And I didn't realize until a little while later why that might be. And I feel like perhaps the anesthetic, the general anesthetic that they used to put me under during surgery, may have contributed to that at the time where my blood-brain barrier was still fragile, and an anesthetic's meant to penetrate in it anyway. I'm pretty sure it's meant to penetrate the blood-brain barrier, and it impacted my inflamed, damaged, whatever you want to call them, neurons, sensory neurons, and it made matters a little bit worse. Now, I think that it's improved since then because now there's 6 years beyond that surgery. But I feel like it is definitely worse than it was at the beginning. And I didn't learn about the blood-brain barrier until around about that time or after that surgery. And now I'm very aware of why we need an intact one. And I want to know how we can support one and why we want to support an intact blood-brain barrier.
Yeah. So the blood-brain barrier is basically just is a collection of cells that then have these little extensions that wrap around our blood vessels. And by wrapping around our blood vessels, it prevents bigger molecules from passing. So the smaller molecules like ions, like sodium and like salt and potassium can easily pass, but like larger proteins aren't going to pass. Those inflammatory toxins are not going to pass. Bigger proteins like so glucose or ketone bodies are going to pass really easily for fuel into the brain. But that blood-brain barrier, those extensions, they're made from astrocytes. And when you have inflammation, the astrocytes aren't getting enough oxygen to keep up their little holdings and connection, right? So,
and what are astrocytes? What are astrocytes?
They're a cell that are in the brain. And I guess the best way to describe them is they are this like star-looking cell that have extensions that wrap around the blood vessels, and they wrap around the blood vessels to protect it, and that's what makes the blood-brain barrier. And so if those are damaged, now those extensions are lost, and so now there's no barrier between the blood and the brain, so things can easily pass through. I should note that the blood-brain barrier is not completely all consistent. There are areas that are supposed to not have the blood-brain barrier because they are areas that are going to sense things faster. So, for instance, kind of like when you eat something bad, and it's like an instant like, oh, that's bad, and you get nauseous. So your hypothalamus, the very deep part of the brain, there's an area that there's no blood-brain barrier there. And because it just needs to be able to sense things very fast. There's a part called the area postrema, which is the vomiting center. Again, there's no blood there because there's no blood-brain barrier there, because if we eat something that we need to throw up, right, it's boom, it needs to happen. And so whatever gets into our blood goes in there, it needs to happen, but it's those small areas. When you have too many areas that are open to the blood-brain barrier, then too many toxins get in, and again, those toxins aren't able to get out, and that's what perpetuates that inflammation. And so astrocytes can be best supported actually by ketone bodies. So astrocytes, they actually make ketones, and they utilize ketones for energy. They utilize glucose as well, but they utilize ketones for energy. And so that's where like a ketogenic diet or ketone bodies. I know Dr. Clark talked about beta hydroxybutyrate, which is just a specific ketone body, can be really beneficial for general brain health. Yeah.
Awesome. So the blood-brain barrier, again, we can intervene in what gets through simply by what we consume. And that's another form of a little bit of control, supporting the blood-brain barrier to keep out as much toxins as possible during that time where the brain is recovering from this inflammation that was caused by the stroke or the injury to the brain. And one of the things that you briefly mentioned earlier, to bring all of this stuff that we've spoken about already together, to bring it together even better, we spoke about breathing, we've spoken about the blood-brain barrier, we've spoken about the autonomic nervous system. I want to talk about how sleeping is one of the things that actually supports to clear the brain of toxins in that phase that you mentioned, in that sleep phase that you mentioned earlier. Why it's important and how all of these things support each other. So the way I understand it is, if you go into bed, you have a 5-minute meditation, you're doing the 4 seconds or 5 seconds in, 6 seconds out breathing, you're supporting yourself to go into a better sleep cycle. When you're going into a better sleep cycle, you have more REM sleep. When you have more REM sleep, you have more ability to detoxify the brain. And when you're sleeping with your mouth taped and you're breathing better, that's supporting, once again, the well oxygenation of the blood, decreasing inflammation. It supports cells in their recovery. It supports allowing you to wake up feeling more refreshed, because all those things work together. They don't work individually. They all support each other. So tell me about sleep and some of the things that it's important for, like what it does to you, because some people will brag about the fact that they don't sleep a lot. I don't need to sleep a lot. Or some people will tell you that they don't go to sleep until 3 or 4 in the morning. All these things that you hear about, people talk about their sleep, and some of them are not really supportive of healing a brain after a stroke or another injury.
Yeah. So we learn in our sleep, right? I mean, in order to consolidate memories, we need to sleep. And those all happen in the deeper stages of sleep, which again, there are most people sleep on like 90-minute cycles. So it's like you have this like stage 1 sleep, and then it kind of goes down to stage 2, stage 3, REM, and comes back up. And then you kind of might have a little like lucid moment and then come back and you just go through those. And so you might get through like 4 cycles in a night. If you sleep 6 hours, you should get through 4 cycles, right? You might get through more. And you want to optimize the amount of time that you're in those deeper stages of sleep, because that is what's going to, again, get rid of those toxins in the brain, but also help with consolidation of memory. Because those, like at the cellular level, there's recovery that's happening. If you think about like your brain is working all day long, like, you know, if you're sitting on the couch, your brain is still working, right? It's got to do all those autonomic things that you talked about, versus when you go to the gym and exercise, yeah, you can exercise your muscles then, but like your brain is always working. It's the one organ that is always getting 20% of your blood flow. And then it might get more during more intense thought or whatever that may be. But at night, your brain is still working. But what's actually working is those midline structures, the brainstem structures that are working constantly to turn off your big brain. Your big brain is kind of where you have those senses of, I can see something, I see light, I hear a dog barking next door, or a siren going by because, you know, there's, you know, police outside, whatever it may be. And those need to get shut off so that, or like even the feeling, like if you have a partner in bed that rolls over, you don't want to wake up because that partner rolled over, right? You don't want to wake up because they turn the light on to go to the bathroom. And so the brainstem is working all throughout the night to turn off, or to keep that bigger brain turned off. And that allows for that deeper wave of sleep. And that allows that, again, deeper brain, limbic system, memory centers, emotions to restore and recover from all of the things that you learned throughout the day. Whether you didn't learn any, I mean, most people learn at least one new thing every day, whether they like it or not, or you're just basically creating more habits of the days that you're doing, throughout the day that you're doing. That's kind of one thing you mentioned about the autonomic nervous system, about everything that's more automatic. I would say, to one like caveat to that, the autonomic nervous system is everything that's automatic for like your organs. Things where you talk about like your tongue movement or your eye movement, those are actually just like learned habits. And like, you know, when you walk into a room, the first thing you're going to do is kind of survey the room to see, you know, who's there, what might be there. Is there a getaway because, you know, my fight or flight nervous system is up, and if something happens, I might need to jump out a window, right? So there's just some learned habits that happen like that. But that makes the brain more efficient. And efficiency is key, especially when recovering from a traumatic brain injury, from a stroke, because you don't want to be using your frontal lobe, which is supposed to be for creativity, for logical reasoning, for decision making, to do every little thing. You should have daily habits. I wake up, I go to the bathroom, I brush my teeth. Like, those are just things that they just happen because they happen. You shouldn't have to think, oh, should I brush my teeth now or should I go to the bathroom now? No, it just should just happen. And when you have to have extra brain power for those decision making, that's a problem. Sorry, I went on that rant. No. Back to sleep. Yeah, back to sleep. Like,
it's a beautiful rant because they're connected. They're all connected.
Yeah, and so with sleep is about recovery, and recovery is so important for learning and keeping your day going, and then getting rid of those toxins, improving inflammation. And like I said before, if you don't get into, it's a vicious cycle. If you don't get into that deep wave sleep, you don't release the toxins, and therefore you don't heal, and then you have a worse day, and then don't get a deep wave of sleep, worse toxins. So that's why supporting your body the best you can with proper diet and lifestyle changes, and what you just said, having a good sleep hygiene routine where you can kind of settle your brain, get your mind in a way that you can decrease that fight or flight nervous system, activate that rest digest, and have a good sleep.
Beautiful. I'm going to emphasize a couple of things because you did a beautiful job, but I want to really actually emphasize it again, that memory is consolidated when we sleep. So if you're somebody who's had a stroke and memory is an issue, short-term or long-term, and you're in the phases of recovery, and depending on your injury, that might come a long way or it might not. What you need to know is that memory, while you're doing that exercise, is not the most, remembering at that moment is not the most efficient time to remember, to feel like you need to be remembering. So I remember going to my neuropsych assessment, and then they would say, they would do all these exercises. It was about a 3 or 4 hour assessment when they were trying to work out my cognitive deficits. And they would say to me, I'm going to give you the names of 5 fruit, and then in an hour or later on, I'm going to ask you about them again. And of course, I remembered some of them, but I didn't remember all of them. And I remember feeling bad at the time about that, feeling like I had missed something and therefore it was no good. And I was struggling with memory, for example. But I didn't understand that memory gets consolidated better during sleep, because that's kind of the most optimal stage for memory to occur and to be stored. Whereas in the moment, like right now, if my anxiety is up and you're making me try and remember 5 or 10 things in a row, but I'm anxious, it's less likely that those memories are going to stick. So if we're going into an exercise to remember something and then we're anxious about remembering, we might be getting in the way of those memories sticking or getting stored. If we've had a day where we've lacked sleep, we woke up and we couldn't get back to sleep and we didn't have a restful sleep, we're going to struggle with storing memories. If we've got other things on our mind and we're not focused on the task at hand and we're wondering about all these other things that have to happen during the day, we're not concentrating, we might not remember things. So there's a lot of reasons why memories won't stick in the moment at the time. And if you can get your head out of telling you that that's good, bad, or something else, that's a really good way to go. Just remember that that's what sleep does. It helps you to consolidate your memory, and you don't really have to do much more about that. If it's something that's important that you need to know and you have a good night's sleep, it's more likely that that will be there tomorrow because you had a good night's sleep and it got stored at the appropriate time. So just hopefully what that does is give people a little bit of sense of calmness around the fact that they have memory challenges post-stroke, and that for a lot of those people, there are strategies to help support memory, long-term and short-term memory. Of course, if that part of your brain is severely damaged and those areas are no longer functioning, then it's understandable that you might have more longer-term, short-term and long-term memory issues.
Yes, 100%. Yeah. And if people do, I mean, that doesn't mean they can't recover some of that stuff, but it may just take more time, and it may take more effort and actually like hard work training those areas of their brain as well.
Yeah. While we're on the topic of sleep, let's talk about people who need some information about sleep, where they can't sleep, they don't know how to sleep, they've lost the ability to sleep, all these things you hear people talk about. And then what they do is they go to alcohol or cannabis or some other substance to help them apparently go to sleep. Does alcohol and marijuana in particular actually help people sleep and get a good night, restful sleep, and go through the cycles appropriately and peak and reach peak REM sleep?
Yeah, no, I mean, they generally, because they're depressants, they generally help you get to sleep, which some people do have problems with, right? And they feel like they need that. But when it comes to restful sleep, no, you don't actually get into the deeper waves of sleep and the restful sleep when you are using alcohol or cannabis. It just doesn't happen. And so it's a tough thing, because people, they'll wake up feeling not really rested, but they're at least I got to sleep. I wasn't, churning with my anxiety all night. And so some people, like with cannabis, we do recommend, like, yeah, if that's what you're going to need for right now, that's okay. And we're going to work on other things and other reasons. But yeah, my biggest suggestions for falling asleep with people is a couple things. First one is the sleep hygiene and like turning off screens. I mean, ideally it's probably like an hour or 2 hours before you go to bed, but most people can't do that. So at least 30 minutes, and just getting a routine of brushing your teeth, getting your things ready for the next day, maybe planning, writing down a to-do list for the next day, getting things off your mind, journaling, whatever you want to do, read a book, but don't do any of that in bed. And when you get in bed, the only thing you're doing is breathing and then going to sleep. There's an old adage that's like, the only thing that should happen in bed is sleep and sex. And I am a firm believer in that. Like, you shouldn't be doing work in bed. You shouldn't be doing schoolwork. You shouldn't be studying. You shouldn't be anything like that. Bed is a sanctuary for mostly sleep. And so, sleep hygiene is huge. But then L-theanine and magnesium threonate. Those are two compounds that are really, really good. Magnesium, especially the threonate form, has been shown to help pass the blood-brain barrier, because most magnesium is going to go to the rest of your body when you take it, like magnesium citrate or any of the other forms. But magnesium threonate, for some reason, it has this affinity for the nervous system, and so it helps more magnesium pass the blood-brain barrier. And magnesium does this really cool thing where it's a blocker of a specific channel, and that channel has to open when we have memory consolidation. Basically, we have neuroplasticity. And so it's fluid and it allows calcium to come in and then go out. Well, if you don't have enough magnesium, sometimes the magnesium isn't covering that channel, and now too much calcium is going in. And I talked about earlier, all these ions have to be in their proper place. When you have too much calcium going in, that causes this excitotoxic process where the cells are going too much and it's too active, and that can cause anxiety, that can cause lack of sleep, that can cause more inflammation, all those things. So that's why I like magnesium before bed, magnesium threonate specifically, and then L-theanine helps to kind of get your brain waves in a more settler state, like more alpha wave, theta wave tone. So L-theanine is really good too.
Yeah, awesome. There is a book that I've loved that I read about sleep, and I've read a couple of them, but one of them was by Dr. Guy Meadows, and he wrote this he's from the sleep school, and they help people and retrain people to learn how to sleep again, because what they kind of believe is that people basically have lost their process to sleep. They've just become, it's been muddled somewhere, and they haven't been able to get back to their old process of just going back to sleep and sleeping, right? Who knows? Yeah. There's things going on in their head. There's lighting issues at home. There's all sorts of things. Now, what I like to do to help me get to sleep is I switch off overhead lights, and I just switch on warm warm lamps in the house. Yep. Excuse me. And in my bedroom, there's literally just some very small yellow LED lights on a strip that I use that are around my bed that I switch on. They're battery operated, and they just release just a really light glow of warm kind of orange light, yellow orange kind of light. And that's all that you'll get in my bedroom. I'll very rarely go in there with the light on if it's during sleep time. So that's what I do amongst a whole bunch of other stuff, but they're the two things that I really control, because the bright lights on my head on top of my head really buzz my brain out. They really sort of get overexcited. It makes my eyes hurt. And then from there, like, I can't settle down, and I need to sort of just bring down the mood of the environment that I'm in and the room that I'm in, just to sort of make it feel a little more kind of dark and cozy, and something along those lines. So if somebody's interested in reading, you can jump on to, I imagine, every platform and find the sleep book, How to Sleep Well Every Night by Dr. Guy Meadows from the Sleep School. So just a little bit of resources there that people can go to.
What you were saying there about the light too. Yeah. So the neurons that go back to your brain to shut off melatonin production, right? Melatonin is what elevates for sleep. So when it's dark out, we're going to have less melatonin production, therefore we can go to sleep. The neurons that are on the bottom of your retina are activating that process more. So overhead lights are coming down, hitting the bottom of the retina and going back and activating that. And so that's why overhead lights can keep you up at night. So what you just said, like having something that's more on the side, more amber, less full, like LED, can really be beneficial. I actually wear a sleep mask as well, just because I live in Chicago. There's a lot of city lights. I don't have blackout curtains, so I wear a sleep mask. I think that really helps for me too.
Yeah. You'd be a sight. Sleep mask, tape over the mouth.
Oh yeah, don't worry. People have told my wife to get a picture of me. I still haven't happened yet. And I fall asleep first too because I'm out like that.
Yeah.
So.
Yeah. I usually fall asleep quite well. The thing that interferes with my sleep is the need to get up in the middle of the night and go to the loo. Or if I do wake up with a dry mouth, they're the things that interfere with my sleep. And sometimes after those breaks in sleep, I might struggle to get back to sleep. And then I might be tossing and turning. That doesn't happen all the time. I seem to have this cycle as well, which I have 3 or 4 nights of bad sleep, and then it goes back to normal again. And then 2 or 3 weeks later, I have another 3 or 4 days of bad sleep again, and then it goes back to normal again. And I don't know why. I haven't been able to pinpoint what it is that does that interferes with it. I imagine it's got to do with lifestyle factors, right? Whatever happened, at work, or whatever happened with the family, something is playing on my mind and stopping from settling me down, or perhaps something that I've done differently in moments of stress. I've eaten slightly differently, or I've stayed up a bit later. There's some things that do interfere that I'm trying to kind of learn, but I don't seem to be able to find the pattern. But I'm okay with it because I would say that 85% of my sleep is pretty good. Now, I could talk to you for such a long time. I haven't been able to mention anything yet that you haven't been able to answer. And I feel like if I just keep asking questions, you're just going to keep answering them. And I love that. But we do have to wrap it up at some point. And in order to wrap it up with some real good information for people to understand about nutrition, I want to talk about your post specifically on Instagram and what you describe as your carnivore-ish routine. And by that, what I know your carnivore-ish diet means is that what you're doing is the majority of the time you're eating protein and you're sliding in some vegetables. But before that, you were doing, I think, like a 30-day challenge or a 33-day challenge or something of the carnivore diet.
Yeah.
Now, that's going to mess people's heads, because as soon as I heard about the carnivore diet, I was kind of like, what are you talking about? Like, how can that be possible? I've grown up my entire life, 48 years old. I've been told every single day of my life that the food pyramid looks like this. You have to eat all those things in the food pyramid. And if you don't eat all those things, you won't be eating a balanced diet. And there's nothing balanced about eating just meat, apparently. So, or protein. So can you give us, in the next 5 or 10 minutes, a very brief kind of synopsis of diet and how come these supposed crazy fads of the carnivore diet are starting to move into a positive space where people are looking at them seriously, and they're and also seeing massive physiological positive changes when they do go on a diet that is very high in protein, specifically for dealing with traumatic brain injuries and things like that. And then I'll tell you about my experience with diet.
Okay, cool. Let me start first with any change to a diet from like the standard American diet or from processed food is a good change, right? If anybody listening, like, I'm going to talk about some pretty radical, I guess, thinking and ideas, but getting rid of processed sugar, processed carbs, and processed oils, which is mostly in processed foods, and just sticking to meat, fruits, and vegetables. I mean, if you can do that in life, like, you're going to be way better off than, 80, 90% of the people out there. And so when it comes to diet, I mean, I was same way as you with the carnivore diet. I heard about, I was like, no freaking way. Like, there's no way. There's no way this can be healthy for you. Like, I was a big fiber guy before before starting carnivore, I was doing keto off and on here and there. And I was always like, you got to have enough fiber. I got to get my enough fiber and think about net carbs and all that stuff. And because ketogenic diet, great for the brain. I don't think anybody should be on a ketogenic diet long term, but I do think that it can be great on and off cycling and stuff like that. So when I heard about the carnivore diet, I was like, okay, there's all these things out there that are showing benefits for autoimmunity, traumatic brain injury. You know, I have to try this diet because I'm not going to recommend it to a patient unless I do it. So I think I've done it. I've done it strict carnivore 2 times for like 40 days, just during Lent, and then ended it kind of going more carnivore-ish, and and then kind of having what I wanted then afterwards.
Sorry.
So,
I'm laughing because you did it during Lent, which usually during Lent they do the opposite.
Yeah, exactly. So Fridays were tough, right? Fridays were just a lot of fish, basically. But I did my best.
Yeah.
Anyway, so the thing with most people have the awareness, or the most people think that meat is bad, right? Meat either causes cancer or causes cardiovascular disease because of the cholesterol and saturated fat. And that's, this podcast could be years long. Mm-hmm. And so the basic thing is that, to me and a lot of other people, there are a lot of different camps, and some research has been flawed and some research is better. And there are association studies. Association studies don't really take into account bad habits or good habits of other eating lifestyle or smoking or exercise or anything like that.
Let me just explain what association studies are, Nick. Basically, association studies are, we followed 30 people for 1 year who ate red meat. And we saw that at the end of that year, one person had cancer, the other person got diabetes, the other person did this, and the other person had that, and all these things. However, what they don't do is they don't go and ask that person, are you smoking? Are you drinking alcohol excessively? Are you exercising? Are you overweight? Are you any of these things? They don't ask people other questions about what else their habits involve. And then what they do is when their focus is so narrow and the person gets, and then out of the 30 people, there's 10% of them, for example, had heart disease at the end of the 100 days or whatever it is, then what they do is they announce, it feels like, for me, just for the sake of a headline, they announce that we followed this many people for this many days who ate meat, and X amount of them at the end of that period of time had this disease. And then what they do is they quickly associate that disease to meat, and then they release an article that says something in words to that effect. And that's as good research as me going down the road and seeing how many people drive past in a red car and how many of them had a crash, and then associating the people who drive red cars crash more often, just because I saw red cars and I was looking for red cars, and then I wanted to report back on how many crashes they had. I mean, it's terrible data, it's terrible research, and it shouldn't be taken seriously, but it has been, because most of us lay people don't know when somebody's releasing a piece of information like that. We don't know to look deeper and question it and understand where it came from. So that's the association study roughly described by me and what Dr. Nick's talking about.
And you're right. And even if they do look into those other confounding factors, they may list them briefly, but they don't actually put them in the title of the study. So therefore, if people don't read them, then they don't figure it out. So all in all, with a carnivore diet, the diet is basically that you're only eating animal products. So you're eating meat from, beef and lamb and chicken and pork and fish, all kinds of fish. And then you're also eating, the way I did it was also eating organ meats. So you're eating liver or kidney or spleen, which are the most nutrient dense foods out there. And there was actually just a study in 2022, early in March, that showed that organs are the most nutrient dense foods out there because they supply good sources of iron and zinc and these micronutrients that most people are deficient in low or middle income countries or groups. And so it's eating all meat, drinking bone broth for calcium. People eat eggshells for calcium. I don't do that. But doing those things, I eat eggs too. And so it's a high protein, high fat diet, or I guess moderate protein, high fat. And so it basically becomes a ketogenic diet. And what it does is it takes away a lot of the plant toxins that are out there. So everyone thinks, plants are good for me. But no one ever looks at like the possible harm that plants can have. Plants, they are defenseless, right? They can't move, they can't run away like animals can. And so the only way that they can defend themselves from other insects or other bugs or other squirrels or rabbits that are trying to eat them is by making defense chemicals. And those defense chemicals are called phytonutrients. Everyone that hears that term, phytonutrients, are like, oh, phytonutrients, they're nutrients for us, they're good for us, they're made by plants. But phyto actually can mean like they're fighting off. And so what those nutrients do is they do activate things in our body that may be a net good, maybe. They basically help with maybe detox or help to decrease free radicals. But at the same time, it also may damage our DNA. And by damaging our DNA, it causes that to happen. So the thing is with plants is we have to be wary that not everything we eat doesn't have a side effect, just like a pharmaceutical or a supplement, right? Most pharmaceuticals actually come from plants. They come from molecules and they synthesize them or they make them synthetically, and they're going to have side effects, just like herbal medicine is going to have side effects, just at a less rate or less intensity. And so long story short is that we're getting rid of all those plant materials, and those plant materials may help with decreasing autoimmunity, because if your body gets in this toxin and it's like the immune system's already on like this fight or flight, the immune systems already have more inflammation from a traumatic brain injury, from a stroke, then you're more likely to get an autoimmune reaction to this random molecule. The most common one is gluten. Gluten is a lectin. So a lectin is just, it's part of a plant, and gluten is just one term of that. Other lectins are coming from like dairy, like casein is a lectin. Another one comes from tomatoes, legumes, right? Those things. And then also, speaking of legumes have phytates. So phytic acid are going to bind to minerals like zinc and iron, calcium and magnesium as well, and prevent absorption. They basically just go out in your stool. Oxalates are another thing that are mostly in like spinach and rhubarb and turmeric, and high in turmeric. And so even though turmeric has been it can improve inflammation, it's oxalates that preventing you from absorbing zinc and iron. And so that's where there's all these different chemicals that can just prevent you from actually absorbing all your nutrients and can make us even more nutrient deprived. So my experience with the diet was that I thought I was the pickiest. This is a good thing too. I was the pickiest eater as a kid, absolutely pickiest. The only thing I would ever eat, never ate a burger, did not like ketchup. I would eat chicken, steak, and spaghetti, and then ice cream, of course. Oh, mashed potatoes were good too, but no green beans, no spinach, no nothing like that. When I got to college, I started learning about more foods and maybe the healthy parts of plants. So I started trying them and just saying, oh, it's healthy for me, I'm going to keep eating it, I'll like it. When I got to chiropractic school, same thing, kind of learned all these things. I started just trying everything, and eventually I started to then like them. So when I was like, liver, there's no way I'm going to like liver. This is going to suck. My dad ate liver as a kid. He talked about how much he hated it. I just stir fried it in some butter and it was fantastic. And so I eat liver still like I like a pound of liver like every other week. And it's just the most nutrient dense thing. It's nature's multivitamin. And so my experience was that I loved eating meat, and the more that I ate, it wasn't tough because there was a lot of variety with organs and many different types of meat. And then I went to this carnivore-ish, or more like animal-based diet, where basically I have some vegetables here and there, as long as they're cooked thoroughly, so that we can get rid of some of those toxins or break them down. And then a lot of fruit. And so fruit is going to have some natural sugars and fructose. But I am somebody who can handle them. I work out every day. I'm not like against eating carbohydrates. Like I said, I think it's something that the ketogenic diet is great in an initial math, like 3-month period after a stroke or traumatic brain injury, just to decrease inflammation, support the brain with the necessary nutrients, and energy source like ketone bodies. But then you don't need to do it the rest of your life. I mean, then just go unprocessed food and stay meat centric or protein centric, because that is where you're going to get most of your nutrients. Not only macronutrients and protein, most people are protein deficient, but then micronutrients, which is where you're getting that from like red meat. So beef and lamb, and then organ meats as well.
Yeah. What did you notice physically with your body? Any changes in your body?
So got very lean, got much leaner than I was. I also still tried to keep up all my weights, like lifting wise, and I never went down. Actually, I increased in some weight. And then the biggest difference that I noticed was my energy levels from the moment I woke up to the moment I fell asleep. It wasn't like, I go to bed at like 9:15. It wasn't that at like 8 o'clock I'm like, kind of dragging here, just like watching TV or reading a book. And no, it was like I was ready to go. I was, paging through, I was reading, and then I hit the bed and I was out. And sleep has always been way better on a ketogenic diet, but like the energy levels throughout the whole day, like, it was just great. I was just on. You feel just like in tip-top shape the whole time. Yeah. And your brain function and your kind of fatigue levels, what did you notice in your head? Like with no fatigue, like I felt I was sharp with patients throughout the day. I could have a full day and again not have any issue. Wasn't like after lunch I was having that like post-lunch fatigue. It was just constant sustained energy levels the whole day, where I could accomplish more throughout my day.
I can relate to all of that. So my first introduction into the carnivore diet was Dr. Jordan Peterson and his podcast, which is something I listen to a lot. But the fact that, he had been unwell for so many years, and what he did was take some advice from his daughter, who had also been very sick with a lot of autoimmune issues for many years. And what they did was start eating meat. And she also got him to the point of doing that, and then told him to also stop eating vegetables, which he did. And he reports all these benefits from it. And I kind of just took that on board and left it at that. I didn't feel like I was any different or any, I wasn't the kind of guy who needed to go down that path. And then a mate of mine decided that he was going to do that, because he's the kind of guy that does these types of things. He puts his body through these tests and he checks them out. And he was telling me how amazing it was and that I should try it. And he was telling me that he feels like he was on and energy was, very, very constant, and that he lost a lot of weight, became very lean. And I thought, well, I'm going to give it a go as well. And that's what I did. I gave it a go. And I lost 5 kilograms in about 6 weeks. And I would consider myself somebody who ate quite well even before that, in that I was eating very, very, very low amounts of sugars, processed added sugars, that types of thing, very small amounts of carbohydrates, like in the form of pasta and bread and any of that stuff, very, very low. But I was kind of feeling a bit stodgy and didn't really have the ability to shift weight. I'm not as, I don't exercise as much as I used to because of, my condition and my deficits and all that kind of stuff. So I was kind of sitting around this 80 to 85 to 86 kilogram mark. And then I just did this for 5 or 6 weeks and immediately dropped 5 kilos and started to feel lighter. My brain started to feel on again, like the lights were just really bright instead of on. They were just really bright. And I started to notice all these benefits. My belly flattened out. I was sleeping better. A whole bunch of things were just on, and they were working better. And I'm reluctant to talk about it because I'm not a nutritionist, so I don't give advice on nutrition. And there's a disclaimer at the end of this podcast that says, don't take anything that me or my guests say seriously, do your own research and all that kind of stuff. But for somebody who's recovering from a brain injury, me, and for the experience I had with that diet personally while recovering from a brain injury, and I'm saying I'm 10 years into this process, but still recovering or not fully recovered, I don't know what you want to call it. I have never done anything that has benefited me so dramatically in such a short amount of time, and ever that's been as easy as this. And I thought I was going to get bored of it and I wasn't going to enjoy it. We're talking about the carnivore diet right now. I'm salivating just speaking about it.
Right.
And I'm thinking about when I'm going to eat the next steak, or I'm thinking about when I'm going to eat my next meal and what it's going to be and what it's going to taste like and what it's going to smell like. And it's really difficult to do this at this time in our history. And while everybody on the planet seems to be talking about how the meat industry is killing the environment, and the way to save the planet apparently is through becoming a vegan and never consuming meat products ever again. And it's like, because I don't have the capability of having and I don't want to have a combative discussion with somebody, but because I don't have the depth of knowledge to talk about this in detail, it's really difficult to get really good information across to stroke survivors who I care about the most, to understand that A, they're not putting the environment into danger by eating meat, and B, they are doing themselves a service by not eating foods like grains that are sprayed with thousands and thousands of different chemicals all over the planet to keep animals away from them, to kill animals that are eating them.
Yes.
And also when you look at the low FODMAP diet, which is a diet that's been designed for people who have irritable bowel syndrome and all that kind of stuff, one of the main things that is 100% green and definitely worth eating and okay to eat, which won't inflame you or bloat you, is meat.
Yep.
And there's a whole bunch of grains and cereals that are in the avoid category, and nobody's connected the two and made and correlated that the low FODMAP diet specifically says avoid a whole bunch of these things. And some of those things include almonds, pistachios, they include bread, cereals, pasta, plums, watermelon, apples, peaches, cabbage, onions, garlic. All these things are in the avoid eating if you have irritable bowel syndrome. So clearly they're inflammatory, clearly they cause problems, but the only information that I've ever heard about them is that they're good for you. If my mum says to me, you know, I ate some, she'll say to me she ate some garlic, and I'll say, well, congratulations, I didn't do that because it makes me feel sick. She just cannot comprehend how garlic can make somebody feel sick. Now, my mum's 70 something and she grew up in a different time, and, you know, she has her own experience, and then she's just using that to have a conversation with me about. But the reality is that I was consuming all those types of foods that I'm supposed to avoid my entire life, and they were making me sick my entire life. And because I thought that it was healthy for me, or because the food pyramid that I learned at school was the thing that my nutritional information got sort of built around, I used to go back and continue doing that. And to me, it reminds me of knowing that smoking's bad for you and reaching into a packet of cigarettes and lighting one up, even though you know it's bad for you and it's causing you problems. That's the extent of the problem with some fruit, vegetables, and grains. That's the extent of it. They're making you sick, and it's decreasing the quality of your life, just like a cigarette will decrease your quality, and you're going back for it over and over again.
100%. I'm glad you had such a good response, because obviously, you know, most people, I would say, have a decent response to the carnivore diet, but obviously some can't handle it. Some, they can't handle all the fat. They have to, you know, include some fruit or vegetable depending on it. But yeah, like what you just said about it's this notion, and and so many people are kind of brainwashed because we've learned this our whole life that it's just this common knowledge thought that we can't change. And that's kind of going back into the whole cholesterol and saturated fat nonsense, right? We have to be able to have an open mind and to be able to look into this deeper. And that's kind of like what I was, before I started it, I had an open mind. I was just kind of like, let's research this a little bit. Let's see what it's about. And when it made sense, I was like, why not try it? But for those people that are about the, environment, I mean, you can one really good book is called Sacred Cow by Deanna Rogers and Rob Wolf. And they basically talk about the ethical, environmental, and nutritional benefits of eating good meat. And so I think that is something that you can push listeners to if they're questioning it.
For a chiropractor, man, you're hell of a wealth of knowledge, and I am just so excited that I got to come across your Instagram and tell people about you via this interview and share some stuff with people via this interview. We've covered a lot, and you've got to listen to this episode more than once to grasp some of these concepts. And then if something spikes your curiosity, just do a Google search for it and read into it further. That's definitely something that you are going to benefit from listening to this episode once again. Now, the other thing I want to say is go and check out Nick's website, neurologicwellnessinstitute.com. And I don't really care if this is an ad. We're not paying for this. It's not that type of ad. But the whole purpose of this podcast is to bring people on here that are going to make a positive difference to stroke survivors. And I'm not running ads, and I'm not trying to promote anybody or anything, but I want to give people like a resource where it's, stroke survivor centered. And basically what we're doing is bringing you kind of hopefully out of obscurity or your corner of obscurity and just trying to let people know about you. So go to the website, check it out, understand who Nick is so that you get a good feel for why I've got him on the podcast, because I don't want to bring people who are just going to run the usual line, which is you should feel bad about eating this, or you should feel bad about trying this. You should feel good about doing anything that makes you feel good and forget about what other people are telling you. We've taken advice, I have at least for around 40 years, from corporations selling me shit food, telling me that it's good for me. That's made me feel sick. And because they told me it's good for me, I continued doing it, even though it made me feel sick. That's no different to what the cigarette companies were doing. And people like Nick are worth listening to. So that's it, man. That's the ad. I've done it. And I know we weren't supposed to do it, and it wasn't really that. But I love bringing people like you on because I think you're making an actual difference to people's health and well-being, because your approach is completely different. And I'm not saying that we don't need medical people, because without them, I wouldn't be here. So hats off to them. But their expertise stops in the hospital. Once you're out of the hospital, that's the gap that we need to fill. People like you help fill it. Thank you so much for being on the podcast.
No problem. Thank you.
Thanks for joining us on today's episodes. If you're a stroke survivor with a story to share about your experience, come and join me on the show. The interviews are not scripted. You do not have to plan for that. All you need to do to qualify is to be a stroke survivor or care for somebody who is a stroke survivor. And if you are one of the fabulous people that help other people who are stroke survivors like Dr. Nick, go to recoveryafterstroke.com/contact, fill out the contact request form. And as soon as I receive your request, I will respond with more details on how you can choose a time that works for you and me to meet over Zoom. Thanks again for being here and listening. I really appreciate you. See you on the next episode.
Importantly, we present many podcasts designed to give you an insight and understanding into the experiences of other individuals. Opinions and treatment protocols discussed during any podcast are the individual's own experience, and we do not necessarily share the same opinion, nor do we recommend any treatment protocol discussed. All content on this website and any linked blog, podcast, or video material controlled this website or content is created and produced for informational purposes only and is largely based on the personal experience of Bill Gassiamis. The content is intended to complement your medical treatment and support healing. It is not intended to be a substitute for professional medical advice and should not be relied on as health advice. The information is general and may not be suitable for your personal injuries, circumstances, or health objectives. Do not use our content as a standalone resource to diagnose, treat, cure, or prevent any disease for therapeutic purposes or as a substitute for the advice of a health professional. Never delay seeking advice or disregard the advice of a medical professional, your doctor, or your rehabilitation program based on our content. If you have any questions or concerns about your health or medical condition, please seek guidance from a doctor or other medical professional. If you are experiencing a health emergency or think you might be, call 000 if in Australia, or your local emergency number immediately for emergency assistance, or go to the nearest hospital emergency department. Medical information changes constantly. While we aim to provide current, quality information in our content, we do not provide any guarantees and assume no legal liability or responsibility for the accuracy, currency, or completeness of the content. If you choose to rely on any information within our content, you do so solely at your own risk. We are careful with links we provide. However, third-party links from our website are followed at your own risk, and we are not responsible for any information you find there.